Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have now administered approximately 152,000 doses of vaccine in the province. More than 56,500 Albertans have been fully immunized with 2 doses of vaccine. Over the last 24 hours, we have identified 277 new cases of COVID-19 and have completed about 7,500 tests. Our positivity rate currently stands at about 3.9%. There are currently active alerts or outbreaks in 260 schools, or about 11% of schools in the province. Currently, these schools have a combined total of 862 cases since January 11th. There are 370 people in hospital, including 60 in the ICU. Our hospitalizations have plateaued over the last few days, which is a reminder that we must continue to protect the health system. Sadly, I must announce 7 new deaths that were reported to Alberta Health in the past 24 hours. My condolences go out to the family, friends, and caregivers of these individuals. To anyone grieving a loss, please reach out for any support you may need during this difficult time. It is important to remember that we are not alone, even in this pandemic. Working together to support each other is critical to effectively achieve success in getting through this pandemic. This is as true for COVID prevention as it is for mental health promotion. On this note, I want to briefly remind all of us today about why it's so important to work with contact tracers if we test positive or if we've come in contact with someone who was infectious. Since COVID-19 arrived in our province, contact tracing has been a fundamental part of our strategy to contain spread. AHS's teams have been working incredibly hard on this since the pandemic began, doing contact tracing every day, 7 days a week. Since the fall, AHS has worked to increase their capacity to do contact tracing. I know that many Albertans have questions about how this work is going, and we will provide a detailed update in the coming days. Contact tracing remains essential to our ability to keep Albertans healthy and to keep driving our cases downward. To be successful in containing COVID spread, contact tracing relies on a partnership with Albertans who test positive or who have been exposed to COVID-19. Unfortunately, recently, we have seen a small but significant increase in the number of people who aren't participating with the contact tracing process. Up to December, less than 1% of our confirmed cases didn't answer the phone or return calls from contact tracers. Since then, we've seen a concerning rise in those we can't get a hold of, 1.9% of all cases in January and 1.3% so far in February. In addition to this, there has also been an increase in those who were initially willing to speak to contact tracers, but then later unwilling to provide the necessary information needed for us to follow up with contacts. When this happens, public health follows up multiple times to try and obtain the details they need and sends written notice of information requirements under the Public Health Act for those who still do not provide the necessary information. But this leaves gaps that COVID is happy to fill. I know that we are tired of this pandemic, and we all want to ease restrictions as soon as possible and get back to the lives we led a year ago. It may be tempting to think that not providing information will make COVID go away. Unfortunately, the opposite is true. Trying to ignore COVID and not participating with contact tracing only pushes back the day we can ease restrictions further by giving the virus the opportunity to spread farther and faster without being stopped. By working with contact tracers, you're helping prevent spread in the province. You're also helping to ensure that you don't spread the virus to others and that those around you don't pass it on to someone who might trigger an outbreak or end up in the hospital. Contact tracing relies on cooperation. It is a partnership that benefits everyone. Given how easily this virus can be passed on, even a handful of individuals not cooperating can lead to significant spread quickly, which puts our ability to keep easing restrictions at risk. To be clear, the vast majority of Albertans who are contacted still continue to do the right thing and participate fully with the contact tracing process, providing names and contact information for those who could have been exposed. This partnership is an act of kindness that benefits all of us. Right now, with lower new case numbers than we have had for several months, contact tracing is one of the best ways we have to reduce transmission and lower our new case numbers, which means it is one of the best ways for Albertans to support progress towards easing additional restrictions in the future. If you test positive for the virus, or if you are exposed, please cooperate fully with the contact tracers. If you know someone who is tested positive or who has been exposed, please support them and encourage them to do the right thing. We all have a role to play in minimizing any shame or blame in contact tracing to make it as effective as possible. By working with the contact tracing team, you're helping to protect those around you you know and love, as well as those you may not know or ever meet from the devastating impacts this virus can have. Finally, today is Random Acts of Kindness Day, an annual tradition of celebrating kindness and recognizing that we could all use more of it in our lives. This is especially true this year. As winter and the pandemic continue on, we need to intentionally let the signs of joy and hope around us to help carry us through. Fortunately, we don't have to look far for countless examples of Albertans doing just that. Just last week, the Red Deer Hospice received a care package from elementary students at First Steps and Beyond School that included cards for residents and staff and stained glass window hearts to brighten up the facility. Volunteers with the Elder Dog Charitable Group have helped Edmonton and Calgary seniors with health and mobility challenges continue to look after their dogs and keep up with daily dog care activities like walks, something that was especially challenging during the extended cold snap. And recently, high school students from the Strathcona Christian Academy in Sherwood Park prepared signs of encouragement and individual care packages for residents at Capital Care Strathcona. They even personally dropped them off with smiles and waves through the windows. I want to recognize these groups and the countless others doing incredible work in communities across our province for reminding us of the power we have to make a positive impact on someone else's experience or outlook. Today, I encourage every Albertan to show care, compassion, and kindness for someone else. Whether it's buying coffee for the person behind you in the drive-thru, shoveling your neighbor's walk, participating with contact tracers, or sharing appreciation for healthcare workers at thanksforcaring.ca, each kind act will make a difference and provide a much-needed boost for both you and the person who receives that kind act. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Yes, our first question is from Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. Thanks for taking my question. As we continue to see a decline in cases and things starting to open back up, are you worried about people becoming complacent, not only resulting in cases to rise, but more widespread transmission of the variant cases to occur?
Complacency is always a risk, and it's important, again, that we continue to remind ourselves and each other of the fact that it's only because we are following these rules and these measures are in place that we are able to move forward with these easings of restrictions. So absolutely, we need to continue to be vigilant, and we can't let complacency get in the way. Because if we do start to see the slipping aside of the measures, and especially if that happens before we're able to get widespread vaccination underway, then the result will unfortunately be a rise in cases, which likely, again, if we're not able to get that under control with the other mechanisms we have, like contact tracing, may need to have additional public health measures implemented again, which none of us want to see happen.
Operator, can you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Have decisions been made yet on benchmarks for pausing or moving back in the reopening plan? If so, what are they? And if not, how is it possible that more than a week into step one, those have not been determined?
We have always been clear that we're watching the numbers, the leading indicators of our positivity rates, of our new case counts, and our R-value or our trends to watch whether or not we have stable or continuing decreased growth in those three areas, or if we're starting to see an increase in growth. And that has been the focus. So since we started through these steps, we're looking both at that hospital metric, which is an absolute number, and we're also looking at those three leading indicators to determine, are they stable, are they declining, which are positive signs, or have they started to increase in a sustained way, in which case we would need to consider whether we need to pause our move forward or even in a worst case scenario move backwards. And again, it's those trends and those three indicators that are the important metrics to watch.
Operator, can you put through the next caller, please?
Next is Jesse Wisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. Thanks for taking my question. Now that we've seen variant spread in schools, what extra precautions are being looked at for possible implementation to make schools safer, such as increased PPE, ventilation, or smaller class sizes? The Alberta Teachers Association has asked the government to open discussions on possible next steps if the variant cases should climb, but says it hasn't received any answers on what could be implemented. Do you have any suggestions on what can be done if the variant situation gets worse?
We have been looking at all of the variant cases that we have and all of the locations where we have seen spread, which includes a small number of schools at this time. There are 3 schools where we have seen some limited transmission within the school. The numbers of additional cases have been relatively small, and at this time it doesn't appear that these variant exposures have led to significantly different outcomes in schools specifically than we've seen with our currently dominant strain of COVID-19. So we do continue to watch the literature. We're continuing to be in discussions with colleagues across the country to see if there are other factors that need to be taken into account. What we know is that within households, we've seen very significant risks of spread, which is why, for example, if individuals who live in the same household as someone who's diagnosed with a variant are all staying in that same household while that case is isolating, as you know, that those individuals are considered to be exposed every day. So if one of those individuals is a school child, they will have to stay home from school for the entire duration of time that the individual case is infectious, and another 14 days to prevent the risk of transmission. We are, of course, as I said, continuing to look at emerging evidence on the variants, and if there are additional pieces of work that need to be done, additional steps that need to be taken, we will make those recommendations, but those have not been finalized at this point.
Operator, can you put through the next question, please?
Next is Sammy Hudez with Post Media. Go ahead, Sammy.
Hi, Dr. Hinshaw. I've got a question for you about women's hockey today. We know the NHL season has been underway for over a month now in both Calgary and Edmonton, and that other hockey leagues like the WHL have the green light to get going. But local women's hockey players in Alberta say they're still waiting for the same high-performance exemption to current restrictions that would allow them to train and play. So why haven't they received that exemption yet, and when is it coming?
The team that I work with at the ministry takes in the requests for exemptions that we get and applies the standard in terms of what is required for exemptions to be granted. I'm not personally aware of applications. The team looks through the applications. They determine if the protocols that are being proposed are sufficient to meet the public health standards, and then they determine again the need or not to consider working with those individuals further. So I'm afraid I can't comment specifically on a Women's Hockey League application. I don't know where that's at. But again, we would consider any application in the same way, simply focusing on what are those public health measures that are being proposed to ensure that there's no risk to public health, and whether or not that activity again meets those standards to be able to proceed.
Operator, can you put through the next question, please?
Next is Aaron Collins with CBC. Go ahead, Aaron.
Hey, Dr. Hinshaw. Thanks for taking my question. I actually asked Premier Kenney this a little over an hour ago, and he said it was a question for you. So here goes. Olymel has voluntarily shut down its Red Deer plant. They say it's unsafe to operate, keep it running with the outbreak that's happening there. But we're also told that the facility is in full compliance with provincial regulations and guidelines. That's from AHS. So my question is straightforward. How is it possible that a private business can determine that it's too unsafe to operate, but that business is still in full compliance with provincial regulations? Something doesn't seem right there.
I can't speak on behalf of Olymel, but I can share information that I have been in conversation with my colleagues at the local level about, which is that there has been ongoing work from local public health since November, when initial cases were identified, and there have been no, over the course of many months, there were no significant transmission events. The plant was operating in accordance with the measures that were required to stop transmission in the plant. And the assessment that that plant made, again, I can't comment on why they made that assessment. What I can tell you is that the information from my local colleagues is that they did do that work in an ongoing way over the past many months, and that the conditions within the plant and the precautions that were in place to prevent spread within the plant were up to standards with respect to what was required to prevent worksite transmission. But of course, we know from other experiences that we need to take an approach that looks at the entire community and not just on-site, but also off-site activities. And so right now, that is exactly what Alberta Health Services is doing, is working to make sure that every individual who works at that plant has access to every support that they may need, to all the information that they may need, and that they don't have to make any kind of difficult decision between choosing to isolate or quarantine and losing income, that they have access to all the supports that have been available to them and perhaps have not been offered in a way that they understood previous to now.
Operator, can you put through the next question, please?
Next is Elise Stolte with the Edmonton Journal. Go ahead, Elise.
Thanks. Hi, Dr. Hinshaw. I understand that some supportive living facilities not included in Phase 1A are now getting contacted for Phase 1B, but they're being told that the vaccine will only be available for residents 75 plus, and that residents not eligible will be contacted individually by AHS. Can you walk me through why that decision was made, the pros and cons that you looked at, and what residents younger than 75 can expect when contacted by AHS?
There was a decision that had been made in November when we were looking at the data available to us at that time to initiate the rollout with designated supportive living and long-term care, as those sites had the highest risk of severe outcomes. And then the second part of our rollout in Phase 1 was focused on individuals 75 years of age and over. And the question of those who lived in those kinds of supportive living facilities that were not at that advanced level of care versus those who live in their own homes. At that time, that decision was made again based on the fact that older age is a very significant risk factor, and so wanting to offer the protection to all those 75 and over. Subsequent to that, we have looked very carefully at ongoing data, and with the emergence of variant strains, which we know are more infectious, where we've seen significant challenges in other parts of the country with rapid spread in those kinds of congregate facilities, there has been a determination made that residents who live in supportive living facilities will have access to the vaccine when it is offered at their facility. And so there may have been some contacts that were made at a point before that new data and information and analysis was available. However, going forward, residents who live in these seniors supportive living facilities, licensed supportive living facilities, will have access once the outreach to those facilities begins. And that, again, is based on considerations of emergence of the variant, as well as the new evidence that really does underline the safety of the 42-day window between first and second doses, which allows us to have more flexibility with our vaccine supply.
Operator, can you put through the next caller, please?
Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. 2 questions for you today. First, you didn't answer Julia's question, so I want to re-ask it. What specifically are the benchmark numbers to pause or roll back the reopening plan? And second, some provinces have prepared large venues like convention centers or for mass vaccination campaigns. Others are using pharmacists or dentists to distribute vaccines. What specifically has Alberta done to prepare for supply to ramp up?
Thank you for the question. When we're looking at the metrics with respect to when we might need to move backwards, it's really important to make sure that if we had one specific metric cut off, that wouldn't take into account the issues that we might see with either regional variation, emergence of a large outbreak in one location or another. So essentially what we're looking at is the 3 leading indicators: positivity rate, new cases, and our R value, or that indication of how our transmission trends have been going up or down in the past 2 weeks. And we will be looking at whether or not those are stable or declining, or whether they are at a sustained increase. So we have not there's no particular number, but again, what we need to know is, are those rates, those leading indicators, changing and showing us that that growth is starting to occur in a concerning way, in a sustained way? And if yes, then considering pausing or moving backwards. And again, it's really important that we are able to take into account contextual considerations as well as the current epidemiology, where that transmission is happening, to be able to interpret what those numbers are, to be able to inform a need to either pause or move backwards in this path forward. Second question?
I believe it was using large venues or
large
pharmacists.
Venues. Thank you. Yes. So there will be more information forthcoming with respect to rollout of the vaccination campaign and where Albertans will be able to access it. So you can look forward to an announcement soon regarding all the different ways that Albertans can access vaccine when it arrives in the province. And ultimately what the goal is to be able to offer it in a way that is as convenient as possible for Albertans, so that we can get vaccine when it's shipped here out the door and into the arms of Albertans who want it as quickly as possible.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Next is Chelin Skolsky with CTV. Go ahead, please.
Hi, sorry. Thank you for taking my question, Dr. Hinshaw. Just following up on Kevin's question in regards to possibilities for ramping up distributions to the 50,000 vaccines a week. I guess in terms of mass vaccination sites, you talked about convenience, but can you also speak to how they will also be secured, and in terms of timeline as to when we might get more information about that?
Sure. There's going to be more information coming soon about vaccination. You can expect that within the coming week, that there will be details about some of these questions that you're asking about locations and timeframes, security, how Albertans can book their appointments. So again, you can look for that within the next week, that there will be more details available on all of those things.
Operator, could you put through our second last question, please?
Second last is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, Dr. Hinshaw. I'm wondering if Alberta is considering any proactive steps for workplaces to help contain variant cases, particularly in meat processing plants.
We are working closely with multiple industries and looking at options such as using rapid testing kits to be a part of screening processes, which I want to underline is not a replacement for all of the other measures that need to be put in place, but rather in addition to. We know that there are different types of workplaces where people are together in close proximity in person, where again, there's that potential is there. We've also seen that the measures that have been put in place, we have had many small outbreaks in different meat packing plants across the province since last spring, and that the combination of rapid and widespread testing in those outbreak sites combined with the measures that have been put in place have been successful in stopping those outbreaks. So again, one of the key things that we always need to remember is that it's not just the work site we need to focus on. We need to focus on all aspects of all of our lives and make sure that we are following those public health measures in every aspect of our lives.
Operator, could you put through the final question, please?
Final question is Alana Smith with Post Media. Go ahead, please.
Hi there. My question is also for Dr. Hinshaw, obviously. I'm just going to piggyback on my colleagues here about the benchmarks to pause or roll back the reopening plan. I know you said that there's a handful of different metrics, obviously the positivity rate, new cases, and R value, but what should that R value be? How many new cases can we see where we would see a rollback, or what is that positivity rate? Can you offer any specifics?
Sure. And again, it's not a specific cutoff. What we need to look at are the trends. So the R value, if it's below 1, indicates that our rates of change are declining, that our new cases continue to decline. If the R value is above 1, it indicates that our cases are growing. And the higher it is above 1, the faster they're growing. The positivity rate, obviously, we want to have as low a positivity rate as possible. And so if we see our positivity rate starting to climb, that's a concern. If we see our new cases on average over a multiple week period, if we see those new cases starting to climb, so we're seeing a rate of change in those new cases that's going upwards instead of staying stable or going downwards. Again, it's not about a specific number or crossing a particular threshold of a certain number of new cases in any given day. It's about the change, it's about the trajectory, and it's about the trends. So if those 3 trends indicate that we're seeing growth and we're seeing sustained growth over time, then that's a very concerning metric that would mean we would need to pause or take a step backward in our path.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.